right, all right. I hope you can hear me okay. I decided to turn myself on. Having to use this other camera because I'm also using my microphone. So anyway, here we go. All right, now let me fix all this over here. And I don't even know, it might be playing over there. I'm not sure. Let me fix everything. Let me fix myself over here. Okay. Okay, are we live or are we not live? Okay, I don't see us as being live. Yes, I do. There we are. Okay, we are live. All right. Make sure everybody can hear me okay before we get started again. I've got our stream pulled up and ready. I don't know what this little thing is over here that's popped up in it, and I don't like it. You see that right there, that little green thing? I don't know what that is. I think it's that Defender thing trying to sell me something once again. Hell no, I don't want to do that. All right. Anyway, let me go fix one other thing, and then we're going to come back and talk about it. Hang on. Yeah. All right, I had to go and get some water. Get my little self set down, get myself ready to go. And I didn't even fix my, and look what's happening up here. I knew this was going to be an issue right here. It says we're having trouble streaming to World's Wave. All right, I'm just going to have to take it off. That's okay. We'll just get rid of it, remove it. It's fine. There we go. Remove. Yeah. All right, we're good. Save changes. Now we're ready to go. All right. Good to see everybody again. And yes, we have both. All right, Jack. Look, Jack has to get in on the action. Here's Jack. There you go. You want to see what's going on? There's Jack right there. All right, see? There you go, Bobby. There you go. He's like, yeah, I got to get into the action too, Mama. So I was going to talk about something right quick before the live stream got started again. Remember whenever they're talking to these doctors, hang on a minute. Whenever they're talking to these doctors and they're saying, wait, what is she saying to me? Hang on. Let me see. Oh, boy. Attachment. Let me see what she's got here. Oh, I can't remove it? Okay, thank you, Sprinkle Donut, because I can't stand that thing. I can't stand that thing. Yeah. All right. That's okay. All right. And so my son's telling me now what's happening. Okay, well, that's okay. We'll just, I guess I'll have to pay the damn. Oh. All right. I guess I'll have to pay the $19 and just re-up that stupid thing because I really didn't want it, but it's okay. All right. Let's talk about something. You know how when you go to the doctor's office and they ask you questions like every time I go to my doctor, he says, oh, have you had any trips to the ER? Have you done this? Have you done that since we saw you last, right? That's the questions that they ask us. And so I'm thinking to myself, well, they asked her these same questions and how did she answer them? Apparently, if she was not honest with these people that she was seeing, like, you know, the counselors and stuff like that, what are they supposed to do about it, right? What are they supposed to do about it? Okay, everybody, let's see. Back. Hello. Yeah, let's see. Okay. Yes, hi, Leslie and Pam, both. Great to see you again. Let's see what she's saying. Oh, Lorette, how to stop Defender. You can disable. Oh, thank you, Sprinkle. All right, I'll get to that in a little bit. But that thing is driving me insane because I think that's what that green thing is over here. I think that's trying to, let me look at something, see if we can. Oh, good. We got rid of it right there. Okay, so it was going to drive me insane looking at that little green thing the whole time we're trying to watch the trial. But that's what I was saying about when you go to the doctor's office and they ask you all these questions, right? You're supposed to be honest with them. Oh, thank you. All right. Right there. Anyway, you're supposed to be honest with them and tell them if you've been to the emergency room, if you've seen other doctors, whatever the heck you've been doing, but since you saw them last. That is the issue here that's going on. Okay. Let me fix this over here. Yes, we've got everything. All right. Everything's in place. We're ready to go. We just need the trial to start back again. I hope everybody had a nice little lunch. I want to tell you what I did. during lunch, I went ahead and got myself dressed for the day because I had not done that because this morning, we have to start so early. So anyway, I don't like this camera that I'm using because it's the one with the one on the laptop, and it's just not as good as my other one. But I can't use my microphone on this laptop unless I use the same plug-in hole that you use for the other camera, and that's okay. We'll just go with it like that. So let's talk about this. When they were talking about the term pharmacology what they didn't say pharmacology, they called it. What did he call that when they were talking about taking too many meds, right? Let's see. I want to talk about that for a minute. So let's talk about postpartum and taking too many meds. All right. Okay, here we go. Now, we know that this postpartum period is like the time that begins immediately after childbirth and typically lasts 6 to 8 weeks. So I don't know where they're coming up with this could go on for 2 years situation. In fact, I believe what we heard in the DSM is like it's up to 12 months. I'm kind of really confused because in my mind, and I'm certainly not a doctor or anything like that, but in my mind, I'm thinking to myself, the only way this could happen is if you had some kind of underlying mental illness already that could the depression or the baby blues could make that even worse. Is that what y'all think? Do y'all think something like that could be the reason this is happening? Because it doesn't. When he said 85% of the women who have babies would have that, I'm like, no way. 85% is way too many, right? That's just too many people. And when he started talking about Fenway Park, I'm like, well, you're assuming that all the people that go to Fenway Park are women, and they're not. Okay, when he was talking about 74 of them. Hang on a minute. Let me fix this over here. There. Is that better? I don't know. I might just go back to my avatar. I'm not sure. I did get dressed. Whatever, right? All right. Okay. Look, it cuts you off some. Oh my God, this is so strange. Let's see. All right. I have to look at it this way. There. Okay, whatever. All right, so we're ready. Anyway, I just think that his analogy was a little bit out there, and I don't know that that was the right one to use. So let's talk about some other things over here. Okay, postpartum support. Let's talk about postpartum support, and where would you get that? There is a Postpartum Support International. There's a 1-800 number, and I'm going to put it on here in case somebody is watching this and they need help. It is 1-800-944-4773. You push number 1 for Espanol and number 2 for English. So you can text. You can text to this number at 800-944-4773, and you use 7773. That is a suicide and crisis lifeline for people who think that they are suffering from postpartum. So there you go. Just a little information for anybody who may be watching this, who may need help. It's out there, and it's free, right? Now, let's talk about the stages and the symptoms, because I know that he was trying to describe this during the trial today. And I'm thinking to myself, all right, but here's how it works. Postpartum starts immediately after childbirth and generally lasts 6 to 8 weeks. Your body goes through many physical and emotional changes during this time, with some symptoms lasting months after you have given birth. Getting rest, allowing your body time to heal, and eating nutritious foods can help you recover from childbirth. Now, if you remember, she went out and she ran a 5K just a little bit after this child was born. How? I mean, how could she do that? I mean, your body's completely out of shape after you have a baby. So I don't know how she was able to do that. Postpartum means, or postnatal, refers to the period after the childbirth. Most often, the postpartum period is the first 6 to 8 weeks. We know that, or until your body returns to its pre-pregnancy state. But the symptoms and changes that occur during that postpartum period can last far beyond the 8 weeks. Okay, we know that now. Major body and life changes are happening at the same time during this postpartum period. Some changes are physical. For example, your breast engorgement and your, bleeding, and other changes that occur during the hormones. The bottom line is giving birth is a major physical and emotional challenge. Being a caregiver and adjusting to life with an infant during postpartum period is also incredibly demanding. She knew that. She had other children. Now, pay attention to how you feel after giving birth and let your healthcare provider know if something feels off. Just because you gave birth doesn't mean your care ends or that your health isn't important. You shouldn't try prioritizing Okay, you should try prioritizing resting and taking care of your health in addition to caring for your baby. Your healthcare provider will schedule postpartum checkups with you so that they can continue to monitor your recovery and healing. It's important to attend these appointments because this is where your provider can identify potential complications. This is also a time when you can ask questions and have honest conversations about your healing. So then it talks about postpartum recovery timelines. Your recovery, like your pregnancy, is unique. There isn't one size fits all timeline to postpartum, but there's general timelines of what you can expect. Some of these things that you can expect in the hours and days immediately after childbirth. I think it's important to talk about this. Your uterus needs to shrink back to its usual size. This causes cramps and bleeding, and your provider may even tell you, teach you how to massage your uterus through your belly to help it get smaller. There's hormonal shifts that happen. This can cause symptoms like hot flashes, changes to your mood, and headaches. Then there's your breast will produce milk, and even if you choose not to breastfeed, you will have painful and swollen breasts. It happens to every one of us that's having a baby. Perinatal soreness. Of course, you're sore from having the baby because that's that space in between, right? I'm not going to actually talk about that. Swelling, you're going to have extra fluid. Your body's going to feel swollen. Because you're accumulating a lot of fluid during your pregnancy. Fatigue. Now, here's the thing with Lindsay Clancy. We know she has fatigue. We know that she said she had anxiety. Labor, childbirth, and caring for a newborn may introduce you to a new level of exhaustion. Feeling tired for days and weeks after you give birth is very normal. You hear that, Lindsay Clancy? It's very normal to feel tired and have fatigue after childbirth. And it says, for many weeks, right? Trying to rest as much as you can whenever possible will help you feel better. What are the 3 stages of postpartum? There's the acute phase, which this is the first 6 to 12 hours after you've given birth. You're most likely to experience conditions like eclampsia, postpartum hemorrhage, those kind of things. And your blood pressure, your heart rate could be different. Then there's the subacute, I'm sure I'm saying this wrong, subacute phase. The phase begins around 24 hours after birth and lasts for about 2 to 6 weeks. All right. Your body is still changing, but you're less likely to experience medical emergencies. Some of the concerns your provider may have during this period include cardiomyopathy, postpartum depression, and symptoms related to incontinence. Okay. All right. Then there's the delayed phase, which is this where we're going to say that she's at? This phase lasts from about 6 weeks postpartum until about 6 months postpartum. Changes during this phase are gradual and mainly consist of your muscles and tissues returning to their pre-pregnancy state. Your healthcare provider may treat you for conditions like pelvic floor dysfunction, painful relations, and uterine prolapse in delayed phases. So that's just part of the postpartum situation. So when does it become not normal? That's what I'm trying to figure out. Let me see if anything talks about that. Emotional symptoms. There is emotional symptoms. They talked about this a while ago. Baby blues. Baby blues is a feeling sad and teary after giving birth. While these new feelings can take you by surprise, they tend to go away after a few weeks. Oh, here we go, guys. Let's get back on our trial. Let's see if they've started back yet. All right, come on. Nope, they haven't started back yet. Thank goodness. All right, here we go. I'm just ready for them to start back. I know you are too. Then there's postpartum depression, which they talked about this a while ago. This is a type of depression that can cause extreme sadness and despair in the weeks and months after childbirth. Unlike baby blues, this doesn't go away and it often involves treatment with medication and behavior therapy. Okay, easy enough. Then there's postpartum anxiety, which is what I believe she's dealing with because of the symptoms that is talked about. Postpartum anxiety. Excessive worrying that occurs after having a baby is called postpartum anxiety. It can be accompanied by physical symptoms like losing sleep, heart palpitations. Postpartum depression and postpartum anxiety can often come together. Treatment for postpartum anxiety can also involve medications or behavioral therapy. Here we go. This is another one of her complaints, weight loss. Your body went through lots of changes during pregnancy and childbirth. It's common to have loose skin and stretch marks and stress about this extra weight around your hips or belly. Try to relax and give yourself time to recover. You lose between 10 and 20 pounds before you leave the hospital. Good Lord. That's a lot. Focus on eating nutritious foods and taking care of yourselves, and remember that your body has just been through a lot. Many health conditions can begin after delivery. Well, we just talked about that. Okay. So it sounds to me like she was absolutely dealing with anxiety, not a psychosis. I don't know what y'all think, but that's kind of what I think. Could I be wrong? Absolutely could be wrong. Absolutely. I guess we could all be wrong on that, but I don't know. All right, we're just ready for the trial to start. I just wanted to go over those symptoms just for just a minute before they started back on trial. Um, I just, because I've never experienced any of this, I really don't know how she felt. I don't know what it was like for her, but it seemed like she got plenty of help, with this new baby. So I don't know. I don't know, guys. You tell me what you think. Put this over here. Shut these blinds because the window is. There we go. That's better. That's better. You can actually see the screen and everything else, and we're ready to go. Got my blanket because it gets super cold in this room, and I'm ready for trial. Anyway, here we go. So I actually talked to my son for just a minute, and he explained to me what happened this morning over here on World's Way. Is they're having a technical difficulty, and that's okay. I'm gonna let them get that fixed, and we are good after that. I'm just telling, it's okay. It's okay. All right, there. Okay. Let's see. Yep, we're all ready to go. It is 1:06. They should be coming back any moment now. Let's see. Not yet. All right. Well, I guess we'll just sit and talk for a minute while we wait. I don't like this camera. I just don't like, look how big that is. I wonder if I can change that at all. Let's see. It might be over here. Let's see. I don't think that's going to make a difference. Okay. Well, I guess we just go with it. Rounded corners. It's not let me change anything on this today. I wonder why. Okay, that's okay. Here we go. All right. Oh my goodness, my goodness. All right, there. We're all ready. These glasses have a terrible glare. Have y'all been watching? I don't know how to put this because I don't really like to talk about other creators, but have y'all been watching any of the drama that's going on out there between some of these creators? I mean, it's just ridiculous. I don't want to name their names, but it's like the worst rage baiting mess I've ever seen because they're all kind of going after each other. I'm thinking to myself, what is the point in that? Can't y'all just go get your own content? Why do you got to go after? Why do you got to be showing each other's content and going back and forth and arguing? I mean, that's not really a good look. It's not healthy. I don't know why they're doing that, but I wish they wouldn't. Because some of them are people I like to watch. I was like, I don't want to be watching all that. Here we go. All right. Still waiting, just waiting. Let's see. I might add some music or something over here while we wait. Let's let it get a little bit of this. Hang on. We turn this down some and we'll turn on some music just a little bit while we wait. Let's see. Which one of these do we want to use? How about that one? Yeah. I'm not sitting here just bored. I have to listen to something. All right. Okay. I'm making noise, aren't I? Sorry. Oh, they're ready to go. Ready to go.
Your Honor, for the purpose of the record, we return back to the matter of Commonwealth versus Lindsay Clancy. All parties are present, excluding the jury.
All right, Counsel, can I see it sidebar?
Oh, of course. Of course, sidebar. Here we go. Okay, it's all right. Okay. I don't like this. I just don't like this. Yeah, you know exactly what I'm talking about. Thank you, Pam, because I'm like, Why do y'all got to do this? I mean, I used to enjoy watching them. I mean, and you know another thing, and I'm not being ugly. I'm really not, because I understand. I do. But sometimes I get so just just tired of hearing no new information. They just kind of talk about the same thing, but just say it differently. You know what I mean? I don't. It's like it's like making a story out of the story that's already been told, and I don't understand that. I really don't. So that kind of gets on my nerves a little bit. And I understand that you've got content is content is hard to it's hard to get new content on some of these stories, but you really want to talk about them, because it's something that's personal to you. It's something that you enjoy talking about, and you just try to figure out, well, how can I re-represent? How can I put this back out there in a different way to tell the story, to keep this story out in the public? I get that. But sometimes it just gets a little bit old, because if there's nothing new, it's not breaking, right? And you see these content creators putting on there breaking news. There is no breaking news on some of these stories. It's not a breaking news story until these people are found, right? I don't know. That goes all the way back. Oh, 4 years ago? Oh, okay. Thank you. I wasn't watching YouTube 4 years ago, I guess. I guess that's why I don't know about those things. Well, thank you for clearing that up for me, Pam. I didn't know that. I really didn't. I didn't really start watching it 4 years ago. I started watching it. I think the Gannon Stout story. How long ago has that been? The Gannon Stout story is when I really started watching YouTube again. Um, what I was doing before then. I guess I just wasn't paying attention to YouTube. How about that? Maybe I was into Facebook back then. I kind of gave up on Facebook. I stopped going to Facebook, because what I noticed was people would be posting all these stories and stuff about what they're doing what they're doing. I'm thinking, there's no way you have that much time in a day to do all of that. I don't believe all of that of what I'm seeing is true. So, and it got to where Facebook became all about selling things. Every time you turned around, it was about selling something. And I don't particularly want to watch that. When I want to go watch social media, I want to watch about a story, not about selling something, right? It needs to be about something I'm interested in. So as soon as the trial starts, I'm going to make this just the screen of the trial. You won't see me at all, but you'll be able to hear me, because I don't want us to miss any of the evidence they might be showing this afternoon. I think the evidence is pretty important, and I want to see it. All right. We don't want to hear it. We want to see it. So anyway, I guess I'm gonna have to. I guess Pam and I are gonna have to get some time together to talk to each other and figure out, so she can catch me up on what exactly happened 4 years ago that caused all of this to still be over here now. Because I truly don't know. But do I need to know? Probably not. That's probably just going a little too far. I don't really need anybody else's drama. I have enough of my own drama right here in this house. I'm living in a house that I can't seem to sell, because I don't know, because of the problems with interest rates being too high. Um, I don't know. I got my own drama. I don't need nobody else's drama. Anyway, come on, guys. Let's go. Let's go. We're tired of sidebar. Let's go. It's like they spend more time in sidebar than they do asking witnesses questions. But we are going to be starting on witness number 63. And I believe it's going to be another officer. It's going to be a police officer. What do y'all think? All right. I think it's going to be that other police officer that took over, and then we'll actually hear from the deputy sheriff's people who took over, that kind of stuff. I think that's what's going to happen today. So, take a look over here. Yes, I have to put my little reading glasses on to see the computer screen and all that, because I'm blind. I'm not blind. It's just I have a little bit tiny cataract there. But anyway, it's okay. It's all okay. Okay, let me see what's happening here. Oops, here we go. All right, that's fine. Guess we'll sit and wait. I'd like to count how many minutes that we've been in sidebars the whole week. That'd be interesting, I think. Y'all don't want to hear me sing. I really can't sing. But I'm afraid if I turn this music on, they're going to start talking again, and then I have to go turn it off again. I don't want to do that either. Now, Jack, and Trick are probably going to fall asleep again because it's really cool in here. It's cold, and they had a little bit of lunch, and they might snore a little bit. Just to let y'all know, they snore a little bit. There's nothing I can do about it. They're just dogs. They can't help it. Anyway. Come on, man. Nope. Still waiting, just still waiting. I gotta get this damn nasty hair done something with. I can't stand it anymore. I'm thinking about cutting part of it off. It's just driving me insane. It's kind of getting a little thin. Jack has ran over there because he thinks he's heard something. I really think that the defense was kind of unfair to Letitia Dukes because she has nothing to do with diagnosis, had nothing to do with the medications, and he's drilling her like she was responsible for what Lindsay had been prescribed. It had nothing to do with her at all. It's ridiculous. Absolutely ridiculous. Yeah. Well, thank you, Pam. Appreciate that. It just feels like string. It's like in the back, it's just kind of gotten like thin, like thin. It just feels weird. It's like I don't know. Maybe I need to take more vitamins. I don't know. I need to do something. But thank you so much. I appreciate it. Um, Come on, man. What are we gonna do? We're just gonna sit here? I guess we'll just talk amongst yourselves. I don't know. I don't know what else we can do. Let's see. I'm just going to make sure. Sometimes I'll look over here and like that red line is not in the right place, and they will have started. And I don't want that to happen today. I noticed it was kind of it was not catching up yesterday. Oh, wait a minute. Oh, what's this? Got some breaking news over here? No, we don't have any breaking news. No, we don't. Let's see what we've got going on. Okay. What else is going on YouTube? I guess we can do that while we wait. Oh, no, don't do that. Mr. Stompy over here, I hope we don't have any more problems with him this afternoon. One thing I don't want to happen is for him to start causing a scene in the courtroom again, and the judge over there calling a sidebar to make him stop, because that happened yesterday in the afternoon. I guess I don't know if he was tired, hungry, whatever, but that was not well. That was not good. I mean, I want to see some action, but I want to see it to be action that's doing good, not action that's doing bad. I don't know how is he going to prove her insane? That's what's bugging me so bad, because we're listening to all this. I'm like, how are you proving her insane? How are you proving she was actually in a psychosis from the testimony? Because I'm just not hearing it that way, right? I'm just not. We're more than likely more than yeah. With him, we probably will. You're right, because he cannot control himself, especially if he thinks his client's being made to look bad. But see, when you act like that in front of a jury, the jury gets upset with you. The jury does not want to see an attorney act like that. The jury wants to see professional people tell the story and then let them decide based on what they heard what the story actually is. That's all. That's all they want to hear. They don't want to hear the attorneys being upset with each other over the way they're acting in a courtroom. Courtrooms are so formal, right? Sometimes I wish courtrooms were not so formal. Sometimes I wish it was like everybody's just talking, amongst each other and making a decision based on what you've seen or heard. Not so formal. But I guess it has to be formal. You know, I have this little thing and it's called Crime Radar. And it picks up crime that happening on it's not the actual 911 calls and things like that, but it's like calls into the fire station, calls into other things besides the actual 911, but it lets you know what's going on in your community. Sometimes I would like to just play that for you guys so you can hear everything that happens in a 1 hour period all around us. It's crazy how many things happen in a day's time. It's called Crime Radar. It is an app you can get for your phone. I think it's interesting. That shouldn't be allowed in the court. Yeah, no, it shouldn't be allowed. You're right. It should not. It's not. It's not helping his client for sure. But I am really concerned about the discussion we heard this morning about the doctor allowing her to use a phone to call her husband so she could start telling her husband she heard voices. That was very concerning, and that was kind of bombshell. I want to know more about that. Did it happen or did it not happen? Which one was it? Because they left it like it happened, but they couldn't prove that it happened. So who knows? Is doctor well? Oh, whoa! You know what the bombshell is going to be is when that doctor testifies, they're going to ask about that right there, and that doctor will testify on the defense's side. That's what I think is going to happen there. So we are weeks away from that, but I think he will be testifying. But you know who will not be testifying? Lindsay Clancy will not testify. They normally don't testify. They're usually told by their attorneys, do not testify because it opens the door for the prosecution to ask you questions that you may not want to answer, but you have to answer because you testify. So that's why they usually don't testify, which is kind of interesting, you know. Okay. I need to get me some kind of a back screen of some sort. I'm sure y'all don't want to look at the blank white wall. I don't know. My desk used to be over on the other side. When I first moved into this little room down here, I had my desk on the other side, but I was like, I want to be closer to the window, thinking it might be a little warmer in here. But it really made no difference where I went. I mean, it's just gets cold in here, just crazy. One day I took a thermometer and I laid it down on my floor because it's the bottom floor. The bottom of this house is all tile. So I put this thermometer on the floor because I was like, why am I having to wear socks in the house? The floor is always freaking cold. So I put the thermometer down there, and you know what? This tile floor stays 74 degrees. 74 degrees. It's cold on your feet. I know you're thinking, oh my God, that sounds great. It sounds wonderful. Except I think that's what causes this one room to be so cold. Is because of the floor and the fact that there's just this one window. Oh, they're coming back. Did you see it shake? They're coming back. Excellent. All right, let's go to trial, baby. Let's go to trial. Yay. Okay, let me just put only this up there. There you go.
We could just go back to that.
Sure.
What? Okay. Okay. We're not going to get anywhere today if they don't start testifying. Good Lord. Okay, well, that's all right. I wonder what it is this time. I wonder if it's going to be the witness. I wonder if it's going to be the testimony. I wonder if they're going to bring this other information out. I wonder if they're going to allow that one doctor. Remember, they were talking yesterday about allowing somebody to testify, but then they were like, well, no, we don't need that person to testify. And they were arguing about that. I wonder if they ever cleared that up. I would like to know. Well, come on, Jack. Jack went and got his little chew stick. He's trying to decide if he wants to come in here and chew his stick or stay in the living room. It's okay, buddy. Come on. You can come over here with your chew stick. Come on. Okay. No, I'm not going to take it away. He's like, pick me up, Mom. Oh, they're coming back. Here we go. All right. It's when it starts shaking and moving, we know they're coming. All right, I'm going to take myself off. Here we go. Let's go to trial. Oh, yeah.
While we're waiting
You too.
for the jury, it just kind of remind again that we've we've got people coming in and out at all times. I want to remind everybody of the pending media order regarding certain pieces of evidence. I also want to remind the warning that I gave, I think it was last week, that there are to be no disruptive statements or anything that's going to disrupt these proceedings. If that's done, they will be dealt with summarily, as we say. All right, so just a warning in regards to that. Okay.
Silly boy. Here we go. Boys and girls. Okay, go lay down. Go lay down. Go lay down. Is she crying? I hope she's not crying. Oh boy.
You're all set? All right, yeah. Ready for the
Okay.
All right, George Andrew.
Somebody's mic is hot.
This court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Everybody, thank you for your patience. Now we'll give you a couple extra minutes to look at the solar eclipse while you're up here. So what we're going to do is we're going to return now to the Commonwealth's case. Commonwealth, call your next witness, please.
Prior to the witness, Your Honor, I would just move to enter in as the next exhibit the excerpted pages from the South Shore Health System Perinatal Behavioral Health Program.
Why is she shaking?
First witness, Letitia Dukes.
Okay, any objection?
By agreement, Judge.
All right, so it's by agreement.
We would call Nicole Bradley as the next witness.
Okay. Nicole Bradley, number 63.
I object. It's not contested. I don't think it's necessary, so I object.
All right.
Okay.
Same finding.
So this witness is not necessary, huh? All right. So says he.
Good afternoon. Do you solemnly swear that the testimony and the evidence you shall give to the jury and the jury will now come between the Commonwealth and the defendant shall be the truth, the whole truth, and nothing but the truth, so help you God? Thank you. You may have a seat.
Watch your step, please.
Hey, good afternoon.
Good afternoon, how are you?
Good, thanks. Just going to ask you to keep your voice up so the jury can hear you and speak into that microphone, okay?
Okay.
Thank you. Yes, come on.
Thank you. Could you please tell the jury your first and last name?
Yeah, Nicole Bradley,
And where do you work?
Plymouth County Sheriff's Department.
What do you do there?
I'm an Assistant Deputy Superintendent of the Field Services Division.
And as one of the roles of the Field Services Division, does the Sheriff's Department engage in what's called hospital watch?
Yes, we do.
Can you tell us very briefly what that is?
Yep. So if any safekeep, detainee, or inmate goes over to the hospital, we use our deputies and matrons to cover them on a security watch.
And are the employees from the Sheriff's Department who are on those watches required to log
Oh my God.
who comes and goes from the individuals who they are there to watch.
Yes, they are.
And are those records kept in the normal course of business at the Sheriff's Department?
Yes, they are.
And you're familiar with those records and what they look like?
Yes, I am.
If I may approach.
Okay. All right. You want to approach and then?
Yes, please. Thank you.
Then there'll be no objection.
Thank you, Pam.
Take a quick look at that.
She might know about that.
And does that packet reflect the hospital logs that are kept by the Sheriff's Department?
Yes, they are.
And you're familiar that between January 25th, 2023 and February 3rd of 2023, that the Sheriff's Department engaged in hospital watch on a patient by the name of Lindsay Clancy.
Yes, I am.
All right, those may be admitted.
No further questions. Thank you.
Mr. Reddington?
No, thank you.
All right, thank you, ma'am.
Thank you very much.
Okay, I know why. Now I know why. They needed those records to be brought in and for her to say those are the records. Okay. Now we're on witness number 64. Okay, got it. I'm with it.
Decided by a judge, it's
Okay.
not contested,
All right.
it's not necessary.
All right, same finding, same analysis. Thank you.
Got it.
Good afternoon, ma'am.
Good afternoon.
Can you stop right there? Raise your right hand for the clerk, please. What's your step, please?
Good afternoon.
Good afternoon.
All right, Ms. Sprague?
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
Yes, my name is Renee Stonebridge, ReneeStonebridge.
Where do you work?
I work at the Commonwealth of Massachusetts at the Boston office.
And what department do you work for?
I work for the Chief Medical Examiner's office.
And how long have you worked there?
I have worked there since July of 2017.
And can you describe your educational background?
Yes, I did 4 years of college at SUNY at Stony Brook in New York. I was a double major in German languages and literature and biology. And then I did 4 years at the American University of Antigua, where I got my medical degree. I also graduated with honors, magna cum laude. After that, I did a 4-year combined anatomic and clinical pathology residency program at NYU Winthrop Hospital in Long Island, New York. I also served as chief resident during my final year there, so 2016 to 2017. After that, I did a 1-year forensic pathology fellowship at the Boston office of the chief medical examiner. And then after that, I did a 2-year neuropathology fellowship program through Brown University at Rhode Island Hospital. And I am board certified in forensic pathology, anatomic pathology, clinical pathology, and neuropathology.
What is neuropathology?
Neuropathology is the study of the brain, the dura, the eyes, and spinal cord, and muscle.
What is your role at the Office of the Chief Medical Examiner here in Massachusetts?
My role there is the Director of Cardiac and Neuropathology. I'm also a medical examiner, but my primary focus is brains and hearts.
And so will there be an occasion where a medical examiner is doing an autopsy and they will send you either a brain or eyes or things of that nature to examine?
Yes.
And why are those things sent to you in particular?
We have certain criteria that is followed in order for a neuropathology consult to occur. Some occasions are any children under the age of 2. I am to receive the brain, typically the spinal cord, depends on circumstances, the eyes and the dura as well. Also, if there's any suspicion of some type of homicidal injury to the head, blunt trauma, typically, those cases will typically come to me as well. Sometimes there are cases in which it may just be something that is a surprise. One of the MEs is doing the autopsy, the head is opened up and they see something unexpected. They see something that may be hard to diagnose as someone who is not neuropathology trained, or maybe something like a tumor that is unexpected, or a rare neurologic disease, neurodegenerative disease that requires further neuropathologic evaluation.
And were you tasked with doing some examinations regarding Cora Clancy, Dawson Clancy, and Callan Clancy?
Yes.
And specifically for Cora Clancy, what did you examine?
For Cora Clancy, I examined the eyes.
And what were your findings when you examined her eyes?
The findings when I examined the eyes were that there was acute hemorrhage of the extraocular muscles and adipose tissue. So when the eyes are taken out, this happens after the brain comes out of the skull. And there is a thin portion of bone in the bottom frontal portion of the skull where that bone is broken, and the eyes can then be examined on the inside of the head. Obviously, they're examined also on the outside of the head as well. But you can look at the optic nerve, and you can look at the tissue that is surrounding the eyes. So the eyes are within the head with some muscle and some adipose tissue. So there was hemorrhage in these portions of adipose tissue and muscle that is surrounding the eye itself. And then also one of the findings was that the optic nerve sheath on the left side has some punctate hemorrhage. So the eyes, they're sitting in the head, and then there's the optic nerve that connects to the back of the eye and goes to the brain, which sends these signals so people can see. And there was some hemorrhage in this portion surrounding the nerve that connects the left eye.
And are you able to determine by seeing these hemorrhages what caused them?
Hemorrhages themselves are a very general finding. However, given the entirety of the case, knowing what I know from the autopsy findings, I can say it is consistent with something asphyxial.
And why is it that when there's something asphyxial, that means strangulation of some type, correct?
Yes, it can be.
Why is it that these types of hemorrhages occur in the eye?
What happens when there's some sort of asphyxial element to a person, it could be from many different things, but what happens is the blood in the head, if there's, say, some type of compression of the neck or something else that causes asphyxia, there's many things, but if there's some sort of compression, the blood basically gets kind of stuck in the head area. And because the blood can't flow back down through the body, what happens is there's little tiny blood vessels. They're in the eyes, they're in the skin, in the mouth, all over the head region. They basically get blocked up with this blood because it can't move. And these little blood vessels will burst, which leads to these little hemorrhages.
And in terms of Dawson Clancy, what did you examine with Dawson Clancy?
For Dawson Clancy, I examined the eyes as well.
And what were your findings?
The findings were that there was also some acute hemorrhages in these muscle and adipose tissue surrounding the eyes. And then the right eye had some small hemorrhages in the posterior retina and the optic nerve sheath. So the back of the eye, there's the retina within the eye, and the retina connects with the optic nerve at the back portion of the eye. And in this case, there was a little bit of hemorrhage at that connection point where the retina connects to the optic nerve.
And what is hemorrhage?
Hemorrhage itself is just blood that is no longer contained in a blood vessel.
So it's burst from that vessel?
Correct.
And then in terms of Callan Clancy, what did you examine with Callan Clancy?
For Callan Clancy, I examined the brain, the dura, the spinal cord, and the eyes.
And what were your findings?
The findings were that there was hypoxic ischemic changes. Essentially, that means that there has been some sort of incident which has caused the brain to have a certain period of time in which blood and oxygen flow were not appropriate. So in this case, there was a time frame in which there was no blood going to the brain, there wasn't enough oxygen going to the brain, and the brain will show certain findings in these sort of circumstances. One of the things I note is that there's edema. Edema is when the brain starts to swell. Edema is also a very general finding. It can happen in many instances, but The edema basically means that the brain starts to swell, so you don't have the nice kind of bumpy pattern on the brain. It starts to swell up and it gets a little more flattened because the brain is encased in the skull, so now it's pressing against the skull because it's swelling up and getting bigger. One of the other things I noted with that was that there was compression of the ventricles. So the ventricles are almost like a tunnel system inside the brain that allow for the cerebral spinal fluid to flow through the brain and go into the spinal cord. And when the brain starts to swell up, it not only swells up outwards, but swells inwards on itself as well. So these ventricles that are located in the inside portion of the brain are starting to get kind of squashed because the brain is swelling. Another thing I noted was that the brain was diffusely friable, meaning that it's very soft. So one of the things I do on all my brain cases is they go into formalin. The formalin allows them to fix, which basically firms up the tissue. And it makes the tissue more easy to manipulate. A fresh brain coming out of a skull is very soft. It's very easy to damage it. It's very easy to put your fingers through it if you're not careful. So one of the things that gets done is these brains will go into formalin. I typically will let them fix for about 2 weeks or so. And sometimes, regardless of the fixation time at the formalin, sometimes the brain still will not firm up the way it should, because if I'm receiving a brain and it's already has hypoxic ischemic changes, the formalin is only going to penetrate the tissue so much because the tissue is essentially already dead.
Can I just stop you for a second? What is hypoxic ischemic changes?
Hypoxic ischemic changes is when you are getting lack of blood and oxygen flow. So hypoxic is the oxygen portion and ischemic is the blood portion.
So what you saw with Callum's brain was consistent with a lack of blood and oxygen?
Correct, yes.
Which then led to brain death?
Correct, yes.
How long, based on your training and experience, does it take for a brain to start dying after the loss of blood flow and oxygen?
It varies based on different sources. Most sources say it's between about 6 to 8 minutes. If there is no oxygen flow, then the brain will essentially start dying. It depends on, if there's resuscitation that occurs afterwards, but it's generally in the frame of 6 to 8 minutes or so.
And once brain tissue dies, it can't be brought back, correct?
Correct, yes.
I have nothing further. Thank you.
Oh my gosh. Trigger warning here.
Rayton? Hold on, Counsel, hold on. We're going to take a short break, all right? So why don't we
Okay.
take a short break, come out,
Here we go.
right back, okay?
Court, all rise. Jurors, close the notebooks. Please come to chairs, please. This way.
I guess reality sucks, doesn't it? She must have known that was going to be the next witness, and that's why she was trembling before they ever came in the door and started again.
We'll be in a short recess in the courtroom.
Everybody clear the courtroom. Okay, they're going to give her time to pull herself together, I guess. I can understand why that was completely upsetting to her. I can. That's a lot to take in, knowing that a medical examiner had to basically disassemble your child to see what the damage was that you caused, because that's what happened here. And it's very, very sad. Very sad. Yeah, sure does. Yeah, Pam, thank you. I'm listening to this myself, and it's just, you just want to cry, It's not even my child. But to know that, you got to wonder, why do they even do that for? They know that she strangled him. They know that he could not survive. They know that he was basically brain dead by the time they got him to the hospital and they had brought him back. They knew that. Yeah, I don't know. I don't know why they had to talk about that, but I understand it is a trial, and I understand that they are trying to show, you know, everything that happened and that whether she was sane or insane. And how could you do that to your own children? How could you? I mean, that is the job. They're just doing their jobs on both sides. I know that. And now I know why he objected so severely to her testimony. And we had really not seen the defense attorney really be concerned with Miss Clancy's how she was doing in that courtroom until today. That's the first I've seen of him really being what's the word I want to use? Paying attention to her feelings, her little feelings. I think this is the first time I've noticed him pay attention to her feelings was today. Mm. The study of the autopsies are such a morbid thing to talk about, but they are part of life, and that is how they decide what happens to people. And in some cases, there's really no reason for an autopsy, in my opinion. But I'm just a person. I'm not a doctor. I'm not a lawyer. I'm just a human. And I think that you ought to be able to refuse an autopsy in some situations. I mean, like if it's an elderly person and they were on hospice or whatever because they were known to have cancer, is there a reason to do an autopsy on them? No. They died from cancer. They died from whatever the illness was. There's no reason for that. I could never be a medical examiner. I could never look at the things that she's looked at. I could never. Mm-mm. I'm just too soft-hearted. I mean, hearing about it just tears you up. Just tears you up. It's bad, you know. I don't think so either. I know, Leslie. It's just terrible to. It was just terrible to hear that. Just terrible. Do I feel sorry for her? Let's talk about, do we feel sorry for her? I'm sorry that she did this to her children, but I'm not sorry for her. I am sorry for the other family members who have to know that she did this to those children. Mm. All right. I guess we'll take just a minute. I'm going to go grab something before they come back. Hang on, guys. Here we go. Oh, boy. All right. Yeah, I'm good. I'm glad you don't feel sorry for her either. I know people are probably sitting over there listening to us talk about this and thinking, "My God, do you not have a heart at all?" No, I have a big heart. My heart's really too big. My heart's for the children. My heart's for the victims, not the perpetrators, but the victims. That's what made it. I mean, it made it hard for me. I did struggle when I worked in the DA's office, knowing what I knew, seeing what I saw, knowing what was in the evidence room. It really, it's hard on you, you know? You gotta be hard. You gotta be able to close your mind from it when you go home. Just let it, don't talk about it, don't think about it, don't even go back to what you did that day. Just to let it go. It was hard. I'm surprised I wasn't crying right there with her. Actually, on y'all know when I get really upset, I just can't help it. If I get so torn up about it, I'll just be crying online. I just can't help it. You know, we're just humans. We're just humans. That's all. All right, they're still out. You know, I wonder if they have some kind of medication that they're going to give her while she's so upset to help her calm down. I wonder if she's still on any benzos because she does like those, you know. She does like those. Yeah, yeah. If, right, right. That's the question, right? You're right about that. Mm. Come on in out of the bushes, folks. We don't bite over here. Come on in and talk to us. I think the fixing to start back. I thought I heard something. Hmm. And you know, over here on this channel, we are, you are free to voice your opinions. You will not be treated negatively. You will not have derogatory statements made about you. This is a safe space for everybody who wants to be here. So just know that. If you're over on Kick and I have not acknowledged you, it's because I may not see your message. But thank you for coming in. We appreciate it. And I don't even think I said it today. Please like, subscribe, and share. Please go back and watch our other live shows that we've done because we've talked about many different things on this channel. We've covered all kinds of things on this channel. So please go back and watch them in their entirety so we can get our watch hours done, so we can be monetized, so we can start doing benefits, so we can start doing, you know, doing lives and collecting money to donate to things, to benefit things that need benefits. All right, okay. In the way that she deserved to hear everything, yeah, you're right. I must be cold hearted, but I think she should have heard what she. I no, you're not cold hearted, not one bit, Leslie. You're not. Nobody here is cold hearted because she did need to hear. As a nurse, she knew what would happen. She knew that that's what happens in autopsies. She knew they would do an autopsy. I guess it's not real until somebody's telling her in that courtroom what they did to her baby after what she did to her baby. This was an 8-month-old child. 8 months old. Mm. I just cannot. Mm-mm. Yeah, just too much. Exactly. Right, Pam, exactly. Jack hears me. I have this little thing, and I make a noise, and Jack's running over here like, "What you got there, Mama? What you got over there, homie? What you got?" He's such a bad dog. All right, I'm gonna have to give him a little bit of a treat, but that's okay. We can do this all at the same time, right? All right. These babies love animal crackers. I'm telling you, but they don't like the HEB animal crackers. They only. This is so strange. They only like the circus animal crackers. Um, But I think it's called Barnum and Bailey's or something. What is it called? It's Barnum's Animal Crackers. That is the ones they like. If you get the other kind, they won't eat them. It's so strange. Weirdos. These are weird dogs. Anyway, all right. Hey there, Jack is saying hello, Bubby. Yeah. Let me say hello to Mr. Jack Jack and his persnickety little self. Let me see. Make sure. Yeah, they're still out. Oh boy. So it's almost 2 o'clock. And we know that they stop about 3:45 Texas time. So, yours love peanut butter cookies. Aren't animals funny? You know, I know it's not good to give them, whatever they want. I know that, but I can't even have the snack unless I share with them. So my husband's like, well, just tell them no. They're patient. I'm like, I'm not going to tell them no. They're my babies. I mean, they're my replacement children. Everybody has left me. My children are all grown. I know that Tristan's over in college. He's never going to move back home. I already know this now. So all I have left are my little twin uh, French dogs, French bulldogs. So that's it. That's a hard realization when you realize that your children, they're never moving back home. It's very hard. I thought that I thought that I had experienced everything hard that could ever happen, but realizing you're an empty nester and that your child is never moving back home, that you've done all you can do, they're happy living without you, is hard. I just cried and cried, man. Just cried. And same with your pets, right, Pam? I just cried. I was like, what is wrong with you? You should be happy. I said, I'm happy, but this is you. When you've always been a mom, it's so hard to stop being the mom. It really is. So, I mean, because I have a child that's 40 something, and I have one that's passed away, and then I have one that's 19. So I've been a mom for many, many years. So anyway, I know Ron's going, what do you mean 40 something? Yes, buddy, I know how old you are. Sorry. Oh my God. In fact, this weekend, I'm going to go and celebrate Ryan's birthday with him because his birthday is going to be on the 19th. So I'm excited about that. Very excited. Next May, we're taking the whole family. We're going to go on a trip. I'm even taking my 43-year-old on the trip with us. It is really hard not to be a mom. It is. I mean, some of us were just basically made to be a mom, and we just grew up always knowing that we would be a mom and that we would do anything to help that child. Anything. Unlike this person over here did. I mean, I always put those babies first. Always. I know, buddy. I know. There you go. All right. And I can't, for me, mental illness or not, I cannot understand how anybody could hurt their own child. They gave birth to that baby. How can you do that? It is like, it is so foreign. To me, it is so foreign how a person could do that. I just don't understand. I never will. Mm-mm. Not a bit. All right. Here you go. So she must be really upset. Maybe they are to do this thing where she's not in the courtroom whenever they do these kind of witnesses. Yeah, you either, right? It's just too much. Too much. It's mm-mm. Okay, buddy. There you go. Let me see. Exactly, Leslie Literally. I still try and get my daughter me too. I mean, I don't care. I don't care how, okay, this is a perfect example. For my 19-year-old, I know you carry them for 9 months and then how can you take their life? I don't get it. I don't get it. I will still, even though my older child is going to be 43 years, I will still, if he needs something and he can't do it himself, even though he owns his own company and all that, I would go get it for him. I would do it for him. I damn sure would, because he's always going to be my child. It does not matter, It just doesn't matter. Yeah. I was talking about this a while ago that, like next May, we're all going to go on a trip together. We're paying for the whole family to go on this trip together. I know my son could pay for it himself, but I told him, no, you're going on the trip with us. We're paying for it. That's it. That's it. Exactly. I'm telling you, I tell you though, I've been thinking about this too. What was going on in their home? Something was going on in that home. I think something else was going on in that home. It wasn't just the kids. I think there was just something else because it's like it doesn't make any sense. None of it. How do you go from a mother of two to you have this other baby, the mother of three, and then all of a sudden life is so hard that you can't deal with it anymore and you end up taking the life of all three of your children? What in the world was going on behind the scenes? Something just seems so completely off about the story. I don't know what it is, but I want to know. Because how can they judge fairly if you don't have the whole picture? You know? Yeah. When my daughter's husband had to go to North Carolina, I always go, yeah, you always go stay with him. You know what, Pam? I don't blame you. If I had a daughter-in-law, you dang right, I would be staying with him. I don't have a daughter-in-law and I don't have any grandkids. All I have is these baby dogs and grown children. You know, someday I guess it'll happen. Whenever they're ready, it will happen. There's nothing wrong with having children later in life. Nothing at all. This is what I remind my oldest child about because, look, my husband, when I met my husband, he had never been married and he had no children, right? And I am a few years older than he is. And so he just wanted one. He just wanted the one child. So we have the one child. So it literally is okay to have children at older ages. You don't have to be 25 years old. You can do it in your 30s. You can do it in your early 40s now. It's possible. Medical technology, medical has come so far that they can intervene. They can make sure that there's nothing wrong with your child. I mean, they can do. It's just not like it used to be. Just not like it. Come on, man. What the hell are they doing? Oh boy. I wonder what the next witness is going to be. I wonder if the next witness is going to upset her so badly. That's what I want to know. I wonder if it's going to be a police officer, a doctor. I want to hear that doctor. That's who I want to hear, and I hope he testifies today. The other doctor that saw her in the hospital that she allowed, that she was using his phone. That's the doctor I want to hear from right there. Yeah, it's just not like before. It's not. And that's great. It's wonderful that people are not forced to, or I'm not going to say forced, but people don't feel like they only have limited time to have children anymore. Oh, if I don't have a child by the time I'm 30, it used to be like, you used to have such a stigma about it. Oh, you got to have your children when you're early. Because, if you have them when you're later in life, there's going to be something wrong with them. Oh my God, that was the worst. No, that's not always true. It is a possibility, and it is harder to get pregnant as you get older. Yes, that is true. But that does not automatically mean that something's going to be wrong with them. That was the worst medical. It was just the worst BS that had been told for years and years and years. And so you had all these, 18, 19, 20 years, 22-year-old people, 24-year-old people trying to have these babies before they got into their 30s. So it's like a rat race of trying to have children when you can. You can have children whenever you want to. There is no set time. You can, if nothing else, you can always hire a surrogate. That's legal. You can do that. I happen to think that surrogacy is beautiful. So, come on, this is crazy. How many times have we had to have a break today? Is this like the 5th time? Let's see. There was one this morning. Okay, so they got there and then they did the sidebar, and then they had something else. They did a sidebar. And then they did their break. Then they went to lunch. Had a sidebar. I mean, it's been multiple sidebars today, just over and over and over. It is definitely a blessing. You're right about that. You're right. It sure is, Leslie. Now, do I think people ought to be having children in their 60s? No. And let me tell you the reason why. Because we know you're not going to live old enough to see that child be fully grown and living and through college and all that. I just don't think that that's good. But I think anything 50 and under should be okay. I do. I mean, because people live longer lives than they used to. They just do. Because people know to take better care of themselves. There you go. All right, buddy, that's enough of that. You don't need any more of that, okay? No more. We're done. Yeah, you have to cut him off sometime. He would eat the whole bag by himself. Don't lay down, Bubby. It's okay. All right. Still, today is going to be. It wouldn't surprise me one bit if they came in and said, "Okay, well, listen, she can't go on today, so we're just going to shut court down early. So sorry." That would not surprise me one bit. I'd be like, "Damn, I put on makeup and went live for nothing." I'm just joking. I'm just joking, y'all. Oh God. I know people are flipping around going, "Well, why is there nothing on? Why is there nothing on?" I guess if you weren't watching whenever this incident happened, you would not know that, right? So, yeah, it's okay. Let's see. I agree 100%. I wouldn't trade my daughter for anything. She's my whole world to me. Yeah, you're right. They are your whole world, and they should be your whole world. And look, and every decent spouse knows that you love that child more than you ever will love them. That's just the way it works. Just can't. You cannot help yourself, but but that's just how it is. I mean, I know people are like, well, it's supposed to be God, your spouse, and then your children. No, it's my children. Yeah, my children. Absolutely 100% my children. That's right, Leslie. Yes, yes. So this over here is so incredibly foreign. Come on now, let's go to trial. We've been waiting all day. Oh my. Still nothing. Just the nothingness. Well, let me look and see online what else is going on. Let's see. I'm looking on YouTube to see if there's anything we want to talk about while we wait. Oh, guess what? That guy's name was Dan Lawyer. Some of these people are already putting out. There are people already putting out little shorts of Dan Lawyer's testimony where he talked about the fact that she used the phone and that theory was that she was telling them that she heard voices. That's already being put out there. People have already snipped that out and put it out. That's big news. That's big news. That was a bombshell today. Absolute bombshell. Sure was. Let's see. Who else? What do you think about Perez Hilton? Boy, that was a mess, wasn't it? What Perez Hilton did on TikTok. I don't understand that. Wait a minute. There was a solar eclipse today? Where at? How could I miss that? Oh, in Europe with NASA. All right, there we go. I'm like, wait a minute. I didn't see none of that today. Coming to Europe, yes, but not coming to the USA. How about that? Okay. I think that's bull. She was trying to cover her butt. Me too. Me too. Because she didn't even talk about the children. She only talked about herself in that phone call per Patrick. He told us about that phone call. Let's see. Oh boy. Perez Hilton's mom files for temporary custody of his children. Well, knew that was coming, right? Yeah. Exactly, Leslie. Exactly. Let's see. That's about it. Other than the Nolan Wells situation, which that's another situation that I'm very, very unhappy about because the way that has been portrayed is not exactly what happened. And I don't like the fact that you've got other children you're trying to drag, well, they're young adults, they're not children, that they're trying to drag into what happened to Nolan Wells. When those young adults were not even on the aisle. Oh, they're coming back. See that movement? All right,
All right.
we're ready.
Counsel, can I see it? Sidebar?
Oh God, sidebar. Okay. Shit. Jesus, man. Okay. Come on, sidebar. I guess, the judge has to make sure that there are no errors that happen in this trial. Because what you don't want is retrial after an appeal. You don't want that at all. Mm-mm. Because when that happens, it's just more expense to come out and prove the same thing over. Okay, here we go. All right.
All right, George entering.
Here we go. You think his head hurts? He's holding his head.
This court's now in session. Please be seated.
Your Honor, for purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right. Well, members of the jury, I just kind of want to revisit an instruction that I've given you a couple times, I think, during the course of this trial. It's important to understand and remember that sometimes there's evidence that's presented in the trial that creates an emotional reaction. But as jurors who have taken an oath to follow the law, I'm instructing you that the law says you must separate any emotional reaction on your part from the informational value and weight that the evidence produces. Your verdict in this case is going to have to be based solely on the evidence, and it cannot be based on sympathy or anger or passion or prejudice. All right? So you've got to keep that in mind. And so with this, we're going to go to the next witness. Okay.
Commonwealth calls Dr. Barbara Vidal Olson.
Okay. Okay, witness number 65.
Same finding and analysis.
Afternoon, ma'am. Sound like you're busy writing for clerk, please.
Good afternoon, do you solemnly swear that the testimony of the
Okay. Did not catch her name.
All right. Good afternoon, doctor.
Good afternoon.
All right. I'm going to ask you also to keep your voice up so the jury can hear you and speak into that microphone if you would.
Okay.
All right. Ms. Sprague.
Thank you, Your Honor. Good afternoon. Can you please state and spell your name for the record?
My name is Dr. Barbara Olson, BARBARAOLSON. I previously practiced under my maiden name, Barbara Vidal, VIDAL.
Can you describe for us your educational background, please?
I completed my undergraduate studies at the University of New Mexico. I also completed 4 years of medical school at the University of New Mexico School of Medicine. Afterwards, I came to Boston to study the field of pathology at Beth Israel Deaconess Medical Center. I completed a 4-year residency program there, studying both anatomical pathology and clinical pathology. And after my residency, I did a surgical pathology fellowship studying the gastrointestinal tract, liver, and pancreas. And I ended my training doing a fellowship of forensic pathology at the Boston office of the Chief Medical Examiner. I am board certified in anatomical pathology, clinical pathology, and forensic pathology.
And what is forensic pathology?
It is essentially the study of causes that are diseases, disorders, or trauma that results in sudden, unexpected, or non-natural death.
And do you currently work at the Office of the Chief Medical Examiner?
Yes, I'm a medical examiner at the Cape Cod office of the Chief Medical Examiner.
How long have you worked there?
Since 2021.
And approximately how many autopsies have you performed?
I have examined over 1,900 bodies and performed over 800 autopsies.
And When performing an autopsy, is there a specific process or procedure that you follow?
Yes, so an autopsy is composed of many parts. The first part being documentation review, and the second part being the examination of the body, which is broken up into two parts. The first part being the external examination, where I look for identifying characteristics of a decedent, such as eye color or hair color. I also look for any evidence of natural disease or trauma on the outside of the body. And the second part is the internal examination, where I create a Y-like incision on the chest and abdomen and examine the soft tissues, bones, and organs, looking for any evidence of natural disease and trauma. I also examine the brain.
And did you perform an autopsy on Cora Clancy on January 25th, 2023?
Yes.
And did you follow that same process with Cora Clancy?
Yes.
And so that started with a document review, is that correct?
Yes.
And what type of documents are you reviewing when you do that?
Typically, I have a preliminary police report to review, as well as either EMS records or records from the emergency department.
And did you start with an external examination of Cora?
Yes.
And what did you observe during that external examination?
The external examination of Cora, I saw evidence of medical intervention. She was intubated, had various EKG pads and defibrillator pads on her body.
She's already
She also
crying.
had a catheter on her right hand and puncture sites on her left hand and her left groin. She had her neck stabilized with a cervical collar, and she had an intraosseous catheter, which is a type of IV they put directly into the bone on her right lower leg. Her hands at the time of my external examination were covered by police evidence bags, and they were secured at the wrist with tape. When I removed those, the fingers showed no evidence of injury, and the fingernails were all of equal length and intact. And then I noted evidence of trauma of the neck with associated injuries of her head and minor injuries of her right arm and of her legs as well.
And in terms of the injuries that you observed, evidence of trauma to her neck, were there also injuries to her face and neck area that seemed to go along with the trauma to her neck?
Yes, there were findings of the head that were associated with the trauma of the neck.
And what were those?
So on her neck, she had a ligature furrow. A ligature is an object used to apply external force to the neck or compress the neck. And a furrow is simply the pattern of injury that develops underneath the site of compression. So for Cora, her ligature furrow consisted of a linear, horizontally oriented area of pallor or paleness around her neck with distinct superior and inferior edges. On the front part of her neck, the lower half of the ligature furrow was associated with additional red abrasions ranging from 1 to 2 millimeters in size. And on the back of her neck, the superior and inferior edges of the ligature furrow had developed some linear bruising as well.
And what do you mean by a furrow?
So again, the furrow is a ligature is when you have external compression by an object on the neck. And a furrow is simply a pattern of injury that occurs beneath it. It can be an imprint, it could be a pattern, or it could be more developed types of injuries such as bruising or abrasions.
And what about injuries?
All right, Council could.
All right, here we go. I can't do this. Did you hear that? I can't do this.
We're going to take a break this time. All right.
All right. Close your notebooks. Place them on the chairs, please. This way, please.
Is that her nurses? Take her out.
Recess for a few minutes. I'm going to come back. We'll speak to council in regards to schedule. Okay.
Okay, I'm going to tell you right now. this is going to be the end of the trial today because she can't do this, right? Okay, it's too much for her. But here's the problem. It doesn't matter whether you do this today, you do this tomorrow, you do this next Monday. It's always going to be too much for her to hear what she did. It is. I mean, it's very graphic. It's very horrible. It's things you don't want to know. It's things you don't want to hear. But it is the end result of what she did. So I think we're not going to have much more of trial today. So I'm sorry. I'm sorry to hear that. You know, I think that, well, here's the thing. She decided to take this to the jury. Maybe she should have had a bench trial instead of a jury trial. Because a bench trial, you're only talking to the judge. You're not having a jury of your peers judging you. Only the judge listens. Maybe that's what she should have done with this particular, because of the horrificness of what's happened and what was going to come out. Right? I mean, I don't know. I just don't know. Yeah, let's see. She did this and she can't face it. Yes, you're right, Leslie. She can't face it. It's just terrible. I mean, you know, and Sprinkle, Pam's like she shouldn't have had either. Yeah, I know. But you know, the thing is I think a lot of this just started long before this third child ever got there. Yeah, Pam, exactly right. Because of the way she talked about Dawson being the hardest person she had ever known. She was having problems with Dawson already. I mean, I don't know what they're going to do. How are they ever going to finish this trial if she cannot come to court and sit and listen and act appropriately in court? Of course it's upsetting. It's trigger warning. Of course it's upsetting. This is exactly why he is objecting to every one of these witnesses, because he knows the response is going to be, she can't listen to this, right? She can't listen, you know? Yeah, thank you, Pam. Thank you. She can't listen to this. That's the whole thing. That just made me nervous. Why am I nervous? It's not my trial. I would, you know, let's see what we got here. Yeah. Jimmy Myers, welcome. Welcome. Yeah. Come on. Thanks for coming in. Appreciate seeing you. Listen, this is a terrible, terrible, terrible trial. It is. It is. I mean, we've heard worse, but I've never seen the person on trial. I've never seen anybody act like this on trial. We've seen some pretty bad stuff. Lori Daybell didn't even act like that, did she? I don't remember there being a bunch of stops during Lori Daybell's trial either. There just wasn't. She did not get all upset when they discussed the kids, did she? She sat there stone-faced. What about Letitia Stouch? She sat there stone-faced, you know? Never cried, never nothing. Not that I remember. Let's see. All right. Worcestershire, aka Worcester. Okay. Hey, Jimmy. And listen, nice to see you. Thanks for coming in. We appreciate you, but we're actually talking about a pretty nasty trial, okay? Anyway, yeah. It's hard to listen to, but I have zero sympathy for her, right? And then, you know, hit that subscribe button, like, and share, please. Thank you, Sprinkle Donut. Thank you so much. I appreciate you. You know I always do. And me neither, Leslie. And me neither, because I'm telling you that I don't like to cry in public, but sometimes you just do. You've just seen Massachusetts. Jimmy, are you from Massachusetts at all? I mean, I have never been there. I would like to go to Massachusetts. I certainly would. I believe it's probably pretty nice when the leaves are changing and all that. Thank you for coming in. We appreciate. We always like to see new faces. Thanks for joining us today. It's very nice of you to join us. No, you did some what? Let me see what he's saying. What did you do, Jimmy? Okay, did some Yankee. Okay, listen here. Well, listen, we're not going to have trolls. This is a very serious thing that we're watching. So please refrain from making troll comments, okay? We appreciate you coming in, though. I'm going to try to be nice here. Anyway, there you go. Hey, please, okay? Oh, my goodness, my goodness. I couldn't imagine. I just could not imagine. I think her parents feel. Her parents are sitting right behind her. Her mom and dad is sitting right there behind her. And they're watching her break down like this. It's got to be incredibly hard for them not to be breaking down with her as they watch their, yeah. You're a Boston comedian? Let's see. So apparently he's a Boston comedian. Oh, that's okay. Now I understand. Thank you. Now I understand, Jimmy. Thank you so much. Appreciate that. I didn't know. I didn't know what you were. Okay, thanks. No, it's not. It's okay. It's okay. I didn't know you were a comedian. But well, thanks for making us laugh for just a minute. We do appreciate that. I mean, it's hard to watch people cry when they've killed their own children. So a little bit of comedy doesn't hurt anybody. Thank you so much. Appreciate that. Um, so how long have you been a comedian? We'll just talk to Jimmy for a minute. So he's apparently a Boston comedian. He's living there now, but he is from Oklahoma. Okay. And so how long have you been a comedian? Is this something you always wanted to do, or is it just something you decided to do once you got to Massachusetts? You know, this is an interesting story. Let's hear from Jimmy and what he does and how he got here. And let's see. He says Timmy Bridges was born in Nantucket. Okay. All right. Good to see you. Thank you for coming in today. We always appreciate seeing new faces. Yeah. So Jimmy's going to tell us about how long he's been a comedian. It's okay, Jimmy. It's fine. Take our mind off of what's really happened here, which is this woman killed her 3 children with exercise bands, and now she can't listen to what happened to them during their autopsy. It's really bad. Yeah. I'm learning how to write comedy. That is hard. Yeah, I bet that would be hard to learn how to write comedy because sometimes it just doesn't come natural. Is that right? I mean, I don't think I could do it. So good. I'm glad you're doing that. There's this place in Austin. It's a comedy show place, and we saw who was that we saw there not too long ago. I don't even. It's just a little hole in the wall in downtown Austin, and it draws some pretty big name comedians over there. Yeah. Okay. Let's see. Jimmy says my grandfather was friends with Will Rogers. He was Will Rogers. Oh, really? That's very interesting. It really is. Will Rogers, huh? Huh. Small world, huh? Yeah. Well, thank you for telling us your story there. That's interesting. I wonder I wonder what the people in Duxbury think. I wonder how they feel about what she's done. I wonder if they talk about this amongst themselves at the grocery store, that kind of thing, because they know this trial's going on. They know it is. So I wonder if they are, every time they go to the store, like, what do you think about this? What do you think about that? I can imagine being in a small town because I don't think it's a very big town. I think it's kind of a small town. I can imagine that everybody knows about this and everybody's talking about this and what they think about Lindsay Clancy and the family, right? I'm pretty sure that's negative comments all the time. And I don't blame Patrick Clancy for relocating to New York anyway, because there's no way he could have stayed living there, because every time somebody saw him, that's the first thing would think of is, oh, geez, there's that man that woman killed his children, right? That would just be terrible. Absolutely terrible. So I don't blame him for moving. Not one bit. But yeah, I think court's fixing to be over. I do think so. I'll tell you what, Jimmy, why don't you come live with us one day and tell some jokes? Why don't we do a joke show one day? You can come up live with us and we will just have a fun show. Because we do all kinds of things over here on this channel. It's just not serious stuff. We do storytelling. We talk about the appeals process. We talk about executions. We do trials now. We do all kinds of things. So someday we can do a live and you can come up and talk to us. That'd be great. It'd be great. Yeah. Nice to meet you too. Thank you for coming in. Yeah. I always like to hear other people's stories. Let people tell us about themselves. That's fun. It's always fun, especially if you're doing something very, very interesting. Yeah. And I think learning how to be a comedian would be very interesting. You know what? I'm gonna look the name of this place up. Maybe you should come to Austin one day and go and I think it's called Headliners Club or something like that. Let me see what it's called. The comedians. Let me see. I'm trying to remember. It might be Punchliners. It's something different that is only in downtown Austin. So let's see. Okay, it's called Cap City Comedy. It's Cap City Comedy. Yes. So there's a place in Austin called Cap City Comedy, and there's a lot of big name comedians that come to this place. Yeah, learning how to be spontaneous is the hard part. Yeah, Robin Williams was great. You know, I always enjoyed Robin Williams, and it made me sad what happened to him. You know? Anyway, it's called Cap City Comedy. Yes. We went and saw some people from Saturday Night Live over at Cap City Comedy, and that place was full. I mean, it was booked. Okay, let me see who was here. Let me see Cap City Comedy lineup. Let's see who's going to be coming there soon. Okay, comedy lineup. Let's see who's coming over to Cap City soon. Let's see. I'm glad we have something to talk about while we wait to see what's going to happen. Maria Bamford. Here are the headliners coming in August over at Cap City Comedy. Maria Bamford, Sabrina Wu, Matt Brollinger, and Usama Sadiq. I've never heard of that person. Okay. Let's see. Somebody named Charles McBee, Lion Nevels. Let's see. Okay. They're going to do a funniest person in Austin semi roundup on the 25th. They're going to have a contest. That's pretty good. Anyway, so that's what's going on over at Cap City Comedy in Austin. So yes, I actually live in Leander, Texas, which is north of Austin, where the Hill Country starts. If you're new to the channel, we'll just talk for a minute and tell you who we are, what we do, where we're at. So there you go. Let's see. Yeah, I'm originally from Stillwater, Oklahoma, Cherokee Nation. Oh my goodness. You know what? My youngest child is a member of the Chickasaw Nation. So I'm sure you're very familiar with that. How about that? That's interesting. Thank you, Jimmy, for sharing that with us. Oh, they're coming back. See that thing shaking right there? That means they're coming back. We'll see what's going to happen. Thank you, Jimmy. Okay. Yeah, the Chickasaw Nation is huge over there in Oklahoma. Oh, come on. I thought they were coming back. Let's see. Nope, not exactly yet. Not exactly yet. We'll just keep talking to Jimmy. Oh, yeah, cool. Right, it is cool. It's a long story, but anyway, yes, he's a member of that Chickasaw tribe. And let me just tell you this: they are very helpful. If you want to send your child to college, they are very helpful with that. Thank God. It takes some of the burden off the parents. Did you get that opportunity? Yeah, you're just an old Oklahoma cowboy. How about that? Well, you know what, Jimmy? I grew up riding horses my entire life. Sure did. My dad was into race horses and things like that, but I did like barrels. Okay, here we go.
For the purpose of the record, we return back to the matter of call vote for us as Lindsay Clancy. All parties are
Okay.
present, excluding the jury.
All right. Council Sidebar, please.
Okay. She's not going to be able to pull it together this afternoon. She's just not. Maybe they should medicate her. I know this sounds terrible, but maybe they should give her happy pills before they bring her to court. You know? Yeah. All right. Well, I guess we'll just keep talking to our friends over here while we wait. Okay. So Jimmy, is this your first day to be watching the trial, or have you watched it every day? Hopefully you've watched it every day, because it's been very interesting every day. We're on day 12. Yeah. Let's see. Yeah, give her a Xanax. That's right. That's what I was talking about, because benzos make you happy, right? You're not all sad. Maybe they should do that to keep her from being upset in court. But I don't even know if that's going to help, because when you listen to what they're talking about, and it makes us upset. So, and if it's your own child, can you imagine how much more upset, even though she did it, I don't know. Just wait and see. I just don't think we're going to have any more trial this afternoon. We're going to have to catch up, You was just passing through and saw Massachusetts. Well, don't be just passing through, Jimmy. Come on back. Come on back and watch the trial with us. It'll be starting again at 8:00 in the morning, Texas time, which I believe is the same time schedule that you're on. No, you'll be on Massachusetts time, I guess. But which is 9:00, but it's 8:00 in Texas when we start trial. Yeah, so. But so good to see you. You have to come back so we could actually have you come live and talk to us one day and tell us your story about how you got into comedy and all of that kind of thing, and where you went to school, that kind of thing. That'd be so much fun. I really love to have new people come in and talk to us. It's just fun. So, I had, let me see. I missed a lot of this on the first part till we came here, right? Really? Aw, okay. I missed a lot of this. Thank you. Thank you, Pam. It's hmm. I wonder how long it's going to. I'm sure that the prosecutor's going, hey, look, if we have to stop this every time she gets upset, this trial is going to last us 8 weeks, not the 3 or 4 weeks that they think it's going to last. Because every time you stop and you send these jurors home, we got to start back over. I mean, how many hours a day of court can you possibly have? What if they had maybe 3 hours or 4 hours of testimony today, period? The rest of it's been sidebars and lunch and, it's just like they're having a party over there or something, which I know they're not, but yeah, anyway, yeah. Oh my goodness. That's going to be the talk of the town today on YouTube, that she kept crying and crying and crying. And I know that people are going to be putting out little shorts of her crying. I'm not going to do that to her. Not going to do that to her. I do have a heart. Yeah. Felicia, have they called it for the day? I think they're fixing to, Felicia. Hey, so nice to see you. Thank you for coming in. I think they're fixing to call it for the day because she cannot continue.
All set.
If you're new to the channel, thank you for coming in. We appreciate seeing you. Please hit that thumbs up on your way in, your way out. I don't know if they're going to call it, but it seems like they might. I don't know. Maybe they're going to continue. Everybody's standing there. Looks like they're going to bring in the jury at least. I don't know. Let's see. Can they put her in another room? They certainly could put her in another room. They could put her in a breakout room and just let her watch. They certainly could. She doesn't need to answer any questions. I don't know why they don't do that to begin with. She doesn't need to be seen. It only says that they are. It only says, I'm trying to remember exactly how they state this about why the defendant needs to be present. Let me see. All right. Okay. There's her parents.
Court's now in session. Please be seated.
Your Honor, for the purpose of the record, we return back to the trial of Commonwealth versus Nancy. All parties are present, including the defendant and the 18 jurors.
All right.
Oh, she's back on stand. Maybe they're not calling it.
You had described previously the injuries to Cora's
Okay.
neck. Were there also injuries on her face that correlated to those marks?
Yes. On examination of her face, she showed diffuse petechial hemorrhages of the skin of the face, most prominently around the skin of the eyes. She showed petechial hemorrhages on the inside of her eyelids as well as the inside of her lips.
And if I could have photo 2246, please. Doctor, there's a remote here. If you press and hold the top button, you can highlight what you're talking about in the photo when it.
Okay, y'all. Yeah.
What are we seeing here? Is that the area of the petechial hemorrhage?
Yes. In
Me
this photo,
either.
I have
Now, they're not going to
pulled
show us
down,
this.
And on the inside of the lower lip, we can see punctate hemorrhages, which are the petechial hemorrhages.
Okay. And if you could, is that working for you? I can let me just see that.
I'm glad they're not showing us these pictures.
This area here?
Yes.
Okay. You just hold that top button and hold it down. And so we can remove that photo. When you talked about petechial hemorrhage in the eyes and eyelids. Did it look similar to that?
Yes.
And basically, it's those red marks all around the mouth, and then those same red marks were on the eyes,
Yes.
eyelids. You tell me where they were.
So they are pinpoint hemorrhages that occur. And again, they were located on the inside of the eyelids. So I inverted the eyelids and I flipped open the inside of the lips, and they were also in those locations.
Mm,
And if we could
terrible.
have, photo of 7784, please. If you could tell us what injuries were here in this photo.
In this photo, we are looking at the body from the left, and you can see the ligature furrow in this photo. Here is the linear area of pallor with the distinct superior and inferior edge. You can also appreciate in this photo some small punctate hemorrhages or the petechial hemorrhages of the face.
And if you could show photo 7782, please. What are we seeing here in terms of injuries?
In this photo, we are looking at the front of the neck, again focused on the ligature furrow, which is this distinct area, linear area of pallor. And on the front of her neck, the lower half of this ligature furrow had scattered red abrasions associated with it.
Take down the photo. What are abrasions in terms of what you do?
So abrasion occurs when there is sufficient friction against the skin to cause a removal of the superficial layer of the skin.
Is it basically a scrape?
Yes.
And can we have photo 2256, please?
Mm.
You can tell us what we're looking at here, please.
This is a close-up photo of the back of the neck. Here is the
Terrible.
linear area of pallor with the distinct superior and inferior linear edges. You can appreciate that the linear edges in this photo started to develop linear bruising.
And were there other injuries on the body other than those on the neck and the face?
Yes, she had injuries to her right arm and on her legs.
And if I could show you photograph 7789. Are you able to tell us what we're looking at here?
This is an up-close photo where we can see a very small, faint bruise. All of the bruises
This is
on
on
her
Cora.
legs as well as her right arm consisted of small scattered bruises.
And if we could have photo 7770. What are we seeing here?
This is an image focused on her right leg. Here we see 3 bruises on her knee and 2 bruises on her left lower leg. This is a site of medical intervention, the intraosseous catheter site where the needle enters the bone.
And if we could see
Amen.
7790, please. What are we seeing here?
This is a close-up photo of her left leg. Again, we can see a bruise here as well as a bruise here on her left lower leg.
And then the last photo.
And she's crying again.
I'm sorry, one more after that. What are we seeing here in this photograph?
In this photo, we can see the bruises I described earlier, as well as the inside of her left ankle. We're seeing 2 additional bruises.
And if we could see photograph 7794. What is shown in this photo?
This is an image of her left leg, again showing the 2 bruises close to her left ankle and then additional bruises on her left lower leg.
And then 7775, please. What are we seeing in this photo?
This is an image of her right arm extended, and I have the image focused on her right bicep where there was 3 small bruises.
And in terms of bruising, are you able to tell the age of a bruise by looking at it?
No.
Can you tell whether it's a fresh or an old bruise?
So generally speaking, we can appreciate the color of bruises. So red, blue, purple bruises tend to be bruises that occur more recently. And as they heal over time, they start to take on a yellow or green appearance.
And the bruises that you observed on Cora's body, how did they appear?
They all had versions of red appearance to their shapes.
So because
Fresh.
they had red appearance, does that mean that they are fresh wounds?
They occurred recently.
And again, you can't tell how they occurred or what the exact time and date they occurred.
Correct.
Is there any information you can glean from the location of the wounds where some of the bruises were close together, like the 3 on the knee or the 2 on the lower right leg?
No, I can only document where they are and their measurements.
Now, if I may have a moment.
Sure.
Going back to the injuries on her neck, what do those tell you based on your training and experience, when you're trying to determine the cause of death? What do those wounds tell you?
When I see a ligature furrow that is horizontally oriented in association with significant petechial hemorrhages, those findings are consistent with a ligature strangulation.
And what is ligature strangulation?
Again, a ligature is an object used to apply external force to the neck, and a strangulation is when it is done by someone else.
And when that happens, what effect does it have on the body? How does it? What is the mechanism of death?
Ligature strangulation results in a category of asphyxial type of deaths. Asphyxia means that the body is deprived of oxygen, and in this case, specifically the brain. So when you have compression on the outside of the neck, blood is how oxygen is delivered throughout our body. So the right side of the heart delivers blood to our lungs, where during breathing and respiration, we then put oxygen into our blood. It then moves to the right side of our heart and gets pushed out to our body through blood vessels we call arteries. Once the oxygen is released at its targeted site, it then recirculates to the right side of the heart through blood vessels called veins, and the process starts all over again. It's a continuous circulation. But when you have compression of the neck, first and foremost, your airways reduce, it's compressed. So you can have a reduction in your ability to breathe or complete inhibition in your ability to breathe. When you have compressions of the veins of the neck, the blood cannot drain from the head. And so then the blood actually has a backwards flow of pressure that meets the arterial blood. And that results in an increase of blood pressure within the blood vessels, as well as an overall increase in intracranial pressure. And with the compression of the artery, there's no oxygenated blood being delivered to the brain.
And as this blood is gathering in the face and head area, is that kind of causing the same type of pressure as a balloon filling up?
You need to stop showing
like
that.
A water pipe as well.
And what happens as that blood pools and causes that pressure in the face and the head?
What normally happens is, first and foremost, the brain just has a reduced ability to take in oxygen. And in the smallest vessels in the face and brain, such as capillaries or venules, they are subject to rupture.
And as that pressure is building in those veins and are rupturing, is that painful?
Just like our blood vessels run throughout all of our body, there are nerves throughout all of our body as well. And so there is a component of pain present until loss of consciousness occurs.
And how long can it take, or does it take, for loss of consciousness to happen?
I cannot put a specific time on it. For the interval, there's multiple variables to consider in a case-by-case basis. The type of ligature used, the force of the ligature used against the neck, as well as the intensity and duration of the altercation. However, in situations where there's complete oxygen deprivation, loss of consciousness can occur as early as 10 to 30 seconds, with brain damage beginning at the 1 minute mark and irreversible brain damage and subsequent death occurring around as early as 5 minutes, again with the caveat that there are variables that might accelerate or decelerate that time frame.
Is there a type of constant pressure that's required to cause that loss of consciousness?
Ultimately, once the brain has a critically low level of oxygen, a loss of consciousness will occur. It takes an average of 4 pounds to compress the veins of the neck and an average of around 10 pounds to compress the arteries of the neck.
And so if someone's squeezing something or pulling something around the neck at that 4 pounds or 10 pounds of pressure in a consistent basis without any resistance, does unconsciousness happen faster?
It could occur faster, yes.
What if someone's resisting or struggling or pulling away? Could that take longer?
When the body is in a state of stress, you have a stress response that demands an actual increase in oxygen utilization by our body. So in the presence of an increased demand with a decreased amount being delivered to the brain, it can accelerate the timeline to loss of consciousness.
What do you mean by accelerate the time to loss of consciousness?
It's obvious what she means.
No, overall, you can ask.
It would just make it occur faster.
And so if that pressure isn't constant, say someone struggles and is able to get free a little bit, and then you have to tighten it again, does that make it take longer?
Sustain.
God almighty.
You said anywhere from 5 to 30 seconds. What are the factors? I'm sorry, you said 10 to 30 seconds. Is that correct?
Yes, for loss of consciousness.
What are the factors that are at play for whether it's 10 seconds or 30 seconds?
Again, there's multiple variables. The force of the ligature against the neck, the actual ligature itself, and the intensity and duration of the altercation.
And once someone loses consciousness, do they immediately die?
No. So if there's no intervention, the brain continues to have a lack of oxygen. And so until the brain cells start to die, it's irreversible injury to the brain. The person is alive until the body can no longer sustain the lack of oxygen.
If someone is strangled to the point of unconsciousness and the strangulation stops, can they wake up?
Without intervention is very unlikely.
So do you recall testifying previously that when asked if a person were to use a ligature around someone's neck to the point where they pass out?
Counsel, we had that answer, right?
It's an inconsistent statement.
This is your witness.
I know, and I can impeach with an inconsistent statement.
I see it's sidebar.
Oh my God. Folks, I mean, this is really, I know that the defense attorney is upset because his client is completely upset. I get it. We all get it. We see it. We know this is hard for her. But the prosecutor is going to put their case on exactly as they plan to put their case on. That's how it's done. It's it, period. I just want to get my thank you out there in case they call it before I forget to do it. Because I could see her continually staying upset for the rest of the afternoon. Again, here we are again. I don't know, I don't know what they're going to do about it, but it's bad. Here we go.
Doctor, do you have to continue to strangle someone past the 30 seconds to cause death?
No. Once the brain is subject to oxygen deprivation and brain cells start to die, it's irreversible. And so it will continue to progress towards death if there's no intervention.
What do you mean by intervention?
Resuscitative efforts, if somebody tried to give CPR, if they were hooked up to oxygen machines.
Do you recall testifying previously that it would be your opinion that pressure would need to be continually applied even after losing consciousness to cause death?
Sustain.
Hold
on. Sustain. Next question.
So your
That's
testimony
unfair.
is that you can strangle someone for 30 seconds, let go, and then they die.
I said that in this presence of complete oxygen deprivation, there is a general time frame. And so 30 seconds, I cannot give a specific number to that. Once strangulation occurs, again, the brain starts to be subjected to a lack of oxygen. So whether the ligature is present or whether the ligature is not present, the oxygen deprivation and irreversible brain damage is already occurring.
And there's no coming back from that?
Not without intervention. It's very unlikely. Again, the brain cannot heal those cells.
Did you form an opinion to a reasonable degree of professional certainty, to medical certainty, as the cause of death of Cora?
Yes.
And what was that?
Asphyxia.
And was that by manual strangulation?
By strangulation.
Mechanical strangulation, I mean. Yes. Did you also examine or do an autopsy on Dawson Clancy?
Yes.
And when was that?
January 25th.
It's okay, Pam. It really is.
And did
I
you
understand.
observe injuries on Dawson Clancy when you did the external examination?
I did observe injuries to Dawson. He had trauma to his neck with associated injuries of the head, as well as minor injuries to his left arm and his legs.
And if we could pull up photo 2166. What are we seeing in this photo?
This photo is a picture of the lower lip of Dawson being pulled down, and we can see, again, similar to Cora, these petechial hemorrhages on the inside of the mouth.
And can you also see them on the eyes in this photo?
You can see periorbital petechial hemorrhages, so the skin around the eye.
And were there also those same type of hemorrhages when you lifted the eyelid?
Yes.
And if we could have photo 2149. What are we seeing here?
Dawson on his neck, similar to Cora, had a linear horizontally oriented ligature furrow consisting of an area of pallor around the neck. He had distinct superior and inferior edges to his furrow as well. This is on the back side of the neck, where we can also appreciate abrasions that are in line or parallel with the inferior and superior edges of the furrow.
And if we could have photo 2147, please. What are we seeing in this photograph?
In this photograph, we can appreciate the distinct area of pallor here on the neck, again representing the ligature furrow with diffuse petechial hemorrhages of the skin of the face.
And what are we seeing there on his shoulder?
This is just some dried body fluid.
And if we could see photo 2151, please. What is depicted in this photograph?
This is a similar photograph to the one just shown here, where you can see the distinct area of pallor representing the ligature furrow with superior and inferior edges, and again, the diffuse petechial hemorrhages of the face.
And these photos of Dawson's face, the petechial hemorrhaging on the face, appear to be darker than those and more expansive than those on Cora's face, correct?
They appear more prominent in Dawson than in Cora, yes.
And what can cause the damage being more prominent and more dispersed over the face?
Again, petechial hemorrhages occur as a result of rupturing of small vessels in the skin. And so the fact that there are more present in Dawson is indicative that there were moments where some blood did reach or push through the furrow or the ligature in little spikes or peaks, which would just result in momentary increases in blood pressure that would result in more petechial hemorrhages.
And what would cause that blood being able to flow?
Any movement against the carotid arteries. The carotid arteries are thicker and more muscular than the veins, so they're more likely to push through with the blood. So that could be movement of the ligature or movement of the person handling the ligature or movement of Dawson himself.
So it could be from Dawson struggling, or it could be from more pressure or force of the ligature.
Yes, changes in the pressure of the ligature.
And if I could see photo 2143, please.
Oh my God.
What are we seeing in this photo?
This is the back of his left forearm. It is a little pale with the light, but there were 3 small bruises on the back of his left forearm.
And going to photo 2155. What are we seeing in this photo?
This is a picture of us. So at this point position, Dawson is face down. So we're looking at the side of his right leg, and we can see a small faint bruise here.
And then going to photo 2144. What are we seeing in this photograph?
This is an up-close photograph, but I can appreciate that there are small bruises in the center of the image.
And photograph 2156. What are we seeing in this photograph?
In this photograph, we're looking at the back of the legs. The one closest to us is the left leg. The one farthest from us is the right. You can see bruises here, here, and here, as well as the inside of the right knee.
And so when you said here, here, and here, that was the outer portion
of the left upper leg.
Thank you. We could have photo 2119, please. What is depicted in this photograph?
This is an up-close photo of his hands.
And is there any significance to the blueness of the fingernails?
I would not have called these necessarily blue or cyanotic. That would be more of the discoloration of his face. There is some subtle blueness to the nail beds, which is again a sign of cyanosis, which is just reflective of a decrease in oxygen in the body.
And last photo is the PDF, please. What are we seeing here?
This image, Dawson is face up, and we can see his right and left legs. Here on his right lower leg, we see small bruises. On his right knee, left knee, we are seeing a bruise. And here is a site of medical intervention, the intraosseous catheter site.
And what are you able to tell us about the bruises on Dawson in terms of whether they're fresh or old?
They were all red and purple in appearance, so they were more recent.
And based on your examination of Dawson, were you able to determine a cause of death?
Yes.
And did you determine that to a reasonable degree of medical certainty?
Yes.
And what was that?
Asphyxia.
Your Honor, I'd move to submit the original photos of Cora and Dawson as for identification, and the other, the ones that were just shown to the jury as exhibits.
So mark the first set for identification. Then over the defendant's objection,
Of course.
using the same analysis as stated in the sidebar, those other photographs may be admitted.
The photos of Cora and then Dawson as the next exhibits, please.
It's 228 and 229.
Oh my God, where's our feed? Okay, it looks like the cord is having a feed problem, so just bear with us. I'm pretty sure it'll come back. We know they're not going to show us the pictures. We know that, but it's going to come back. Okay, just bear with us. I'm pretty sure it's the cords. Now, it's not the sidebar. The cord is apparently not going to let us listen, maybe. I don't know what this is. Hang on, guys. Let's see what we can do to fix it. So there she was. I know that they're not going to just take it down. That's not going to happen. There we go. Okay, I will just have to wait for it to come back. It's not a sidebar. They're having live trial, but something happened to the feed in the courtroom, so we'll have to see what it is. I know we can't hear anything. We can't see anything. I don't know. Y'all just bear with us for a second while we see what happens. Because it's going to be every state, every channel is going to have the same problem. So let me go over and look and make sure. Hang on a minute. Yeah, it's the entire feed is down. So for whatever reason, there's no feed into the courtroom right this second. But I'm sure it will come back as soon as they realize that something is wrong with their feed, which is yeah. Yeah, it's terrible. Oh my God, people, please. We're just trying to watch the trial over here. We didn't do anything wrong. She did. Why are we being punished by not being able to have a feed into the courtroom now? I mean, they knew this was going to be hard, really, from day one. They knew this was going to be hard to do. So I don't know what's going on. We'll just wait. We'll just sit and wait and talk about some other things while we wait. Let's see. We get back over here where we were and see if maybe our friends are back. Is Jimmy still in here so we can talk to Jimmy a little bit while we wait on the feed to come back? Let's see. Yep, it's just black on every channel. It's just black. Damn it. So annoying. But that's okay. Here's the thing. Let me tell you this, guys. One thing I'm not going to do is I am not going to do little clips of her crying and carrying on. I'm not going to do that. If I do any clips, it'll be testimony, not her crying, because I am not a cruel person. And I know this is hard for her, and I know she did this. I know, and I know it's a little too late to be crying about it because you've already done it. You can't, there are no take backs. But I'm not going to be cruel enough to show her crying out, and not being able to control herself in little shorts and clips. I'm just not going to do that. I try to have a heart about this. So, yeah. Okay, take the trash out. Okay, Leslie, that's fine. Take out the trash. Let's grab a drink, get a cup of coffee, whatever we need to do while we wait on our feed to come back. It's 3:04 here, which means it's 4:04 there. So they might only go another 30 minutes or so at the trial anyway. Let me see what's happening here. Anything? Wow. Oh, look, right there. They're having a problem with their stream. Okay. I don't think it's over, but we'll see. Let me see what happens here. I think it's just a streaming issue. Okay. I'm going to check other stations and see if anything is happening on the other ones as well while we wait. Let's see. Okay. Let's see. Lindsay Clancy. Here, let me see if this one, yeah, there. Even AP, all of live stream has ended. Don't tell me they shut it down without us. What the damn hell? No. No, I don't think it's not over today, is it? This is wild. They just cut it off in the middle. Okay, let's see what they're saying. I'm going to read you something from a different station, okay, a different channel. Justice for Lindsay and her beautiful children. They see the truth now. Nobody helped the unwell mom. This is what I'm seeing in other chats, okay? Patrick is on vacation. He did nothing to help those kids and wife. Patrick framed her, and it was in his new wife's idea, okay? This is just things I'm reading out of other people's chat over here while we see if it's going to come back. While we wait for a second, I don't know, guys. Pat's new wife should be taking notes. Let's see. Mental illness is serious and real. Help your family members. Don't ignore them. Mental health care and doctors are useless. This is just other people's chat that I'm reading, okay? The funny part about this is when she's found guilty, it's going to show that the healthcare system did nothing wrong. This is what people are saying. Another one is, let's see. Mental health care don't help the mental. Okay. Let's see. Is there something else? So she was so medicated, but she kept refusing to take the medication to make that make sense. Yes, make that make sense. All right, Leslie, thank you. We're not sure if the feed is going to come back or not because over on AP, it says the live stream has ended. So I don't know. This is absolutely bullshit. Okay, guys, I guess our stream is over for the day. I guess we'll have to show back up at 8 o'clock in the morning to be ready for the 9 o'clock trial to start. Well, it'll be 8 o'clock Texas time, which is 8 o'clock Oklahoma time. Okay, Jimmy? But it's going to be 9 o'clock Massachusetts time. So we'll be ready to show back up in the morning. But what I was going to tell you about a while ago before this live stream issue happened is what it says about the defendant being in the courtroom. All that has to happen, okay, hang on a second, pull it back up, is okay. A defendant in court is the person, okay, we know that. Let's see, in the case, what are you saying? Okay. Oh, yes, thank you so much. I'm so glad. I really appreciate everybody coming in today. You know, I love seeing you all always. It's always fun for me to have you with me, even though this is heartbreaking and it hurts us to watch. It's so important. It is important that we watch and form an opinion based on what we see and try to keep our feelings separate, but that's so hard to do. So the only thing the defendant has to do is attend all scheduled court dates, really. But you know, the thing is, she can do that from a side room. She can do that from a breakout room. She doesn't have to be in there crying. And I hope tomorrow they do something different. I have a feeling tomorrow the first person on the witness stand is going to be talking about Callan. Wait a minute. Wait a minute. What's happening, y'all? Oh, look, it's circling. It might come back. Let's see. Y'all see that circling? It might come back. Let's see what happens. I hope so. Let me see. Okay. Let me go look down here and see if this one's still going. Let's see. No, the internet. Okay, YouTube is it circling for you too, guys? Are y'all seeing circling too? Let's see what this is about. Thanks, Pam. Thank you so much. So good to see you. Yeah, I don't know that it's going to come back. It's just circling. All right. Well, we're just going to call it a day and we'll start back in the morning because I do not think it's going to come back. If y'all want to go ahead and go, that's fine. I am going to leave this up for a few seconds to see if it does come back. So if you go do a couple things and you come back and we're back on, great. If you go do a couple things, you come back and we're not back on, then I'll see you in the morning. And as I always say, take care of yourself. Be careful out there. Hey, go hug your babies. You know, life is short and our time with them is even shorter. And the one thing I never want a person to have is regret. If you get the chance today, tell your child you love them. It doesn't matter how old they are. It doesn't matter where they're at. You go tell them you love them. Give them a hug if you can. Go reach out to them. Anyway, I'll see you guys later. I'm just going to leave this up to see if it comes back. Thank you so much. Oh, thank you, Leslie. You're going to wait with me and see what happens? Because really, it's only 3:10, which is 4:10 there. It's only 4:10. Certainly, they've not ended court all of a sudden. I just don't believe that. You know. Here's what I am going to do. I'm going to put that there like that, but then I'm going to go back and let me do this. I'm going to go restart. All right. Right there. All right. Let's go restart YouTube and see if anything comes up. Ooh, look, I'm in color. Living color. There we go. Here we go. Let's see. YouTube. Oh my goodness, my goodness. Let's go. All right. Okay, that one has ended over there. Let's go see if it's over here on WJKR. Let's see. Oh, look, there it is, y'all. Look, what is this? What we got going on here? Let's see. No, I don't know if it's going to come back. I don't know. All right. Yeah. Okay. I don't think it's going to come back on because every one of these other stations just have like it has ended or, WJAR says the same thing. It's not really showing anything. It just pisses me off so bad. Yeah. Let's see. Yeah. Okay. There's not even any other creators over there talking about, oh, it looks like it's ended or anything. People are you just see some chats moving along and that's about it. So I don't know, guys. This is strange. I have never seen this happen. You tell your daughter yeah, I know. Every night you tell your daughter you should. I reach out to my kids all the time too. I mean, I've got one that's 2.5 hours away from me and I've got one that's 45 minutes down the road because he's in college, He's over at the University of Texas. He's in pre-med. He wants to be a doctor himself. He's just turned 19 years old and he's already a sophomore. And in December, he will actually be a junior already. He's very, very intelligent. He's the cutest thing. I always call him my gift from God I didn't know I needed because I was 46 years old when he came along. I know. That's like, listen, people can have kids older age. It's okay. You don't have to be in your 20s. It's fine. You can do it. It's fine. So anyway, I just talk about that. Let's see. Yeah, it looks like they have just ended the stream altogether. It's not coming back. All right, it's over. Okay, it's over for the day. So I'll just see y'all tomorrow. Again, thank you. Let's just call it a day. Love you guys. Come on back when you can. Hey, and Jimmy and all you new people that I saw today, come back tomorrow. Come spend your time with us if you have time. Thanks, guys. Yeah. Yes, and you should. You should tell me good night every night. I am heavy on the texting, just heavy on the texting, so I can make sure I talk to my kids. I just am. I'll see you guys later. Bye.